everyone, my name is Ben Yamuter, and in today's presentation we will be discussing exercise in cancer populations. In order to discuss the effects of exercise on cancer, we first need to fully break down what cancer is. According to the American College of Sports Medicine, cancer is defined as a group of nearly 200 diseases characterized by the uncontrolled growth and spread of abnormal cells resulting from damage to the cell's DNA. Cancer can be caused under a plethora of circumstances. Genetic factors unfortunately mean that a modified gene was passed down from parents to their offspring. A common example of a hereditary gene mutation is seen with the presence of the BRCA gene, which is associated with high rates of breast cancer in women. Environmental factors are largely associated with lifestyle choices, including smoking cigarettes, drug use, alcohol consumption, and diet. Another sad reality that comes with cancer is that it is the second largest killer of American citizens behind heart disease, and it is estimated to take over 600,000 lives in 2020. Most cancers originate in the epithelial tissue of the body, epithelial meaning the thin layer of cells surrounding most organs. However, there are more rare forms of cancer which can arise in blood cells, glands of the immune system, and even some connective tissues. In one way or another, almost everyone knows an individual who has been affected by cancer, whether it was their own personal experience battling the disease, a family member, a friend, and so on. Because so many people are affected by this disease, we have quite a bit of data on who it targets. Half of all men in the United States will have some form of cancer in their lifetime. That's right, 1 in every 2. For women, it is less prevalent, but still shockingly high, coming in at 1 in every 3. The literature shows that cancer can affect anyone of any age, but it is more prevalent in individuals above the age of 55 years old. In fact, 78% of all diagnoses of cancer are seen in adults over the age of 55. As humans age, cells of the body go through a process known as cell turnover. For this to occur, DNA must be copied from the aging cell and successfully transferred to the new cell. As more and more cell turnover occurs, DNA must be copied at the same rate. Some of that DNA is not always transcribed correctly and is referred to as a cell mutation. Consequently, that damaged DNA will begin to copy itself, and if the rate of cell turnover is not regulated, a tumor may form. When anyone is diagnosed with cancer, there are several paths of treatment available, and it is primarily up to the doctor to choose the most effective method going forward. One common route is surgery, which requires a physical removal of all tumor sites in the patient. Radiation therapy is the use of X-ray, gamma ray, or other high-energy particles which act to destroy or damage cancer cells by making small breaks in the cancer cell's DNA. Chemotherapy is a systemic treatment using powerful drugs to kill fast-growing cells in the body. This is effective because cancer cells grow and divide much more rapidly than most human tissues. However, chemotherapy is nonspecific and kills many healthy functioning cells within the human body, which is why the side effects of chemo are so intense. Immunotherapy can only be used for specific types of cancer, including some lung, kidney, and bladder cancers. Immunotherapy boosts the human body's natural cancer-fighting system in order to slow or completely halt the growth of cancer cells. The list of side effects from cancer treatment can sometimes seem endless. One common symptom of any cancer diagnosis is fatigue. A vast majority of cancer patients report feeling extremely tired and have little energy no matter how much rest they get. There are more specific side effects that come with each method of treatment. Immunotherapy has reports of flu-like symptoms, including fever, body aches, nausea, and general weakness. With surgery comes more mechanical side effects ranging from decreased range of motion, muscle weakness, inflammation, and neuropathy, which is numbness or pain resulting from damaged nerve cells. Chemotherapy is accompanied by hair loss, nausea, fatigue, and countless other side effects. So now that we know what cancer is and how it is treated, how does exercise play a role in this conversation? According to the CDC, only 23% of adults in America meet the guidelines for physical activity, which is 150 minutes per week of moderate intensity aerobic exercise. That is less than a quarter of our population who is meeting the healthy guidelines for exercise. In a new study released and reviewed by JAMA Internal Medicine, it was found that leisure time physical activity was associated with significantly decreased risk of 16 different cancers, including colon, breast, and kidney cancers, to name a few. Leisure time physical activity means walks, throwing a frisbee, and even cleaning the house. Yet half of the men and a third of the women in America will be plagued by this horrible disease. Imagine the physiological effects of meeting the 150 minutes of recommended exercise every week. And those statistics are only for cancer, not the hundreds of other preventable diseases that are ripping through the nation. I've digressed from the original topic, which is cancer and exercise, but I just wanted to emphasize how important just a small dose of exercise can be in disease prevention. Now, exercise after diagnosis of cancer can be just as helpful in recovery. Exercise during and following treatment has been associated with reductions in recurrence and mortality by 30 to 60% in breast and colon cancer patients. And it has been found to prevent or reduce many of the negative effects of cancer treatments, such as fatigue, muscle weakness, declines in cardiovascular function, functional ability, neuropathy, body composition, and quality of life. The late cardiac effects of cancer treatment have a profound effect on survivors who have as much as a 70% higher risk for developing cardiovascular disease compared to someone without cancer. Cardiovascular disease is the leading cause of mortality for women with early-stage breast cancer. Exercise may have potential benefits to modulate cardiovascular disease among early-stage breast cancer survivors. A longitudinal study of almost 3,000 women with non-metastatic breast cancer noted that women who adhered to the cancer survivor exercise guidelines versus those who did not had a 23% adjusted reduced risk of cardiovascular events. So, when it comes to prescribing exercise for current or recovered cancer patients, the volume, intensity, and type of exercise can vary greatly from individual to individual. We must account for what method of treatment the person underwent, how severe their side effects are, their age, and tons of other factors. According to the ACSM guidelines, exercise is not only safe for cancer patients, but it is recommended. The current recommendations of exercise is 30 to 60 minutes of moderate to vigorous intensity physical activity for at least 5 days a week. Resistance training should be implemented 2 or 3 days a week, while aerobic exercise should be done 3 to 5 days a week. Patients who have documented spread of cancer into the skeletal system should be very careful when performing plyometrics and heavy resistance exercises, as they are more prone to bone fracture. Despite a rapidly growing body of knowledge about the benefits of exercise for cancer survivors, 80% of oncology care providers, meaning nurses and physicians, are unaware of the exercise guidelines and report a lack of knowledge about them, when to implement them, and where to refer survivors for exercise. For such an effective method of treatment, you would think the nurses and doctors should be more inclined to inform their patients about the benefits of exercise. Now, I also understand that there are many other factors doctors must warn their patients about and how to handle their disease going forward, but a simple statement telling them to at least walk every day would have a major impact on the quality of their life for the patient. Up until a few years ago, some doctors were even recommending that cancer patients stay inactive. Another great research article informed us that there is an indirect relationship between exercise volume and tumor size. The more the patient exercises, the lower the rate of the growth for the tumor. From that same article came a piece of information as follows. What are known as NK cells are efficient cancer-killing cells of the immune system, and with exercise in humans, a great mobilization of these cancer-killing NK cells takes place, pointing even more to the fact that exercise is beneficial for cancer patients. I also understand that almost 90% of cancer patients deal with chronic fatigue, even years after they are cancer-free. So exercise can be a daunting task, but the benefits greatly improve quality of life and even show decreases in fatigue. What is the leading cause of mortality for women with early detected and early stage breast cancer? Is it A, complications from cancer, B, cardiovascular disease, C, diabetes, or D, hypertension? The correct answer is B, cardiovascular disease. Here are my sources, and I hope you guys enjoyed the presentation. Stay safe.